Every now and then I wonder what I want them to say. Tell them not to mention that I have a Nobel Peace Prize. That isn't important. Tell them not to mention that I have 300 or 400 other awards. That's not important. Tell them not to mention where I went to school. I'd like somebody to mention that day that Martin Luther King Jr. tried to give his life serving others. I'd like for somebody to say that day that Martin Luther King Jr. tried to love somebody. I want you to say that day that I tried to be right on the war question. I want you to be able to say that day that I did try to feed the hungry. I want you to be able to say that day that I did try in my life to clothe those who were naked. I want you to say on that day that I did try in my life to visit those who were in prison. I want you to say that I tried to love and serve humanity. Yes, if you want to say that I was a drum major, say that I was a drum major for justice.
Welcome, welcome, welcome back, my Be Health Empowered family. And what a powerful introduction to our show tonight, which is dedicated to Dr. Martin Luther King on this federally mandated holiday to celebrate his birthday. Thank you so much for joining us for another episode of Excuse Me, Doctor. My name is Dr. Melissa Clarke. You can call me Dr. Mel. I am your host. And we are here every single week, Monday night, 9 o'clock Eastern, 6 p.m. Pacific, doing what we do here at Excuse Me, Doctor, talking with you about your health and well-being. And, you know, we do it based on evidence and based on science so that you can be confident and empowered when it comes to making decisions for you, your family, and your community. We clarify speculation, we clear up misinformation, we debunk disinformation, and we also let you know when things are changing as we learn and increase our knowledge. We're here on Facebook, we're here on YouTube. If it's your first time joining us, please hit like on Facebook and subscribe on YouTube. We really appreciate you for that. So now let's get to creating an amazing week for ourselves with all the health topics we're going to cover. Tonight, as I mentioned, is a show dedicated to Dr. Martin Luther King, who by his own self-description was a drum major for peace and righteousness. We're honoring him today as we talk about health justice and the role that each of us can play in our own lives and the lives of our community. You know, African-American mothers die 3 times more in childbirth than white mothers. Our infant mortality rate is 5 times that of whites. And when it comes to mental health services, we only access mental health services as African-Americans half as much, at half the rate that the white population does. And so these are just a few of the statistics when we come to talking about the health of African-Americans. These things also hold true for other people of color when it comes to their health disparities as well. So we're going to touch on all that tonight, the reasons for it, and what each of us can do about it in the spirit of Martin Luther King. So share this episode on anybody who you think might want to be in on this show, who's already working for health equity, or who just wants to magnify their efforts, or just people who want to understand what they individually can do in their community. So, without further ado, I want to welcome my fantastic co-hosts, Miss Lila Mays and Mr. Wayne Bruce. Thank you so much for joining me tonight. How are y'all doing?
Hey.
Howdy.
I hope you can hear. Can y'all hear me?
Yeah, we can hear you.
Okay.
All right. I can hear
Great.
both of y'all. That's a good thing.
All right,
Awesome.
now. That's always a good thing.
Yes. And without further ado, let us hit these numbers. They are out of control.
They are.
As you know, Omicron, we are at like 800,000 cases a day. I remember when we had only had 800,000 cases, period, in this pandemic. So I personally know at least 30 or 40 people who've tested positive since Christmas time.
Mhm.
And
Absolutely.
the crazy thing is that the peak, we're not at the peak yet. Only a couple of places like New York and Chicago have peaked. The rest of the country, especially the rural areas where the vaccination rates are the lowest, have yet to peak in terms of the peak numbers of cases that they're seeing. So it's probably going to get a little worse before it gets better.
So, speaking of numbers, I know there are people traveling, and there have been these stories about cruise ships like still at sea
Right.
because of all the cases.
Yes,
That's crazy.
exactly. It is
It's
crazy. One cruise ship had
wild.
to turn around and go right back to Miami because 50 people tested positive, and another one is just sort of drifting around in the Eastern Caribbean on its way back to New York because they're not able to stop at any islands because they have too many cases on board. And
Hmm.
so, the CDC issued a warning about going out on cruise ships. So I hope that everybody kind of listens to that, because in those close environments, that's where spread happens the most.
Absolutely.
Yeah. Normally,
Absolutely.
for the past 14 years, I would have been out on a cruise ship.
Right.
And
Right, even as
this
we
year,
speak.
things changed. And luckily, I mean, by grace of God, you never know. You always think something is, you know, a, a, a detriment, but it's actually a benefit.
Right, right. And then when we talk about the hospitalization numbers, those have tripled since December 1st. We were at like 50,000 cases. Now we're at 150,000 cases of individuals with COVID in the hospital right now. And even though fewer people are going to the ICU, thank God, and therefore fewer people are dying, we're still at around 2,000 deaths a day from COVID.
Shoot.
And even children's hospitals are overwhelmed now. So yeah, that the hospitalizations, yeah, are it's tough right now. My colleagues that are working in the hospitals, staff shortages, just tired, just fried
Yeah.
out.
Yeah.
Yeah.
Yeah. So then, Dr. Mill, this is a big one. Um, Folks who have perished, this number is crazy as of yesterday. I mean, it's been crazy for some time, but where are we now?
Yeah, 850,000, almost 850,000 deaths from COVID. And just yesterday, 2,600 people died of COVID in one
Mm,
day.
mm.
Um, so yeah, even though you're hearing that Omicron is milder, we're still having Delta out there, and people who are unvaccinated and getting Omicron still have, you know, a higher risk of ending up in the hospital. So
Right.
Yeah.
that's the situation.
Right. A success story happened, personal success story with a good friend of mine who spent 58 days in the hospital, is now home. From
Wow,
Praise
COVID,
God.
and
I
now
mean, I'm just
home
so
that's
grateful.
fantastic.
Yeah.
and working his way back to being one of the top saxophonists
Yeah.
in the world again. So
Yeah.
Yeah,
Yeah.
and
shouts
we
out
know
to him.
Turns up.
saxophonists need their breath, and so
Right.
thank God he is on the mend.
Yeah.
Thank God.
Thank
Thank
Yeah.
God.
God. That's really
58
good
days he's
news.
home.
So
Woo.
speaking of vaccinations, because we mentioned that, we're at about 209 million people vaccinated. About 67% of the population over 5 is fully
Mhm.
vaccinated. Um, and over 40% of people over 18 are boosted. So just a booster reminder, um, people who are boosted have a 75% higher rate of protection from getting symptoms from Omicron. But this is a deal, y'all. We're in a pandemic. Stuff is evolving, right?
Yep.
Omicron is a variant that can circumvent the antibodies produced either by natural immunity, like if you've had COVID before,
Hmm.
and even from the vaccine. But the key is this: if you're vaccinated and you get exposed to Omicron, it's more like a mild flu. And if you're boosted and get exposed to Omicron, it's more like a cold, a mild
Mm.
cold, or no
Okay.
symptoms at all. And so, is the vaccine a magic bullet that prevents you from having infection? No, it was never actually meant to be. The fact that it provided such a high protection early on was kind of like icing on the cake. What has been consistent is that it's keeping people out of the hospital and keeping people alive. And that's the bottom line.
Yes.
All right. Those the numbers and facts. So
Yep.
we kind of touched on this last week, Dr. Mel. I'm gonna get on to this recap stuff. We kind of touched on this last week. Somebody said they were going to make a quilt out of their cloth mask. But I'm with you. I thought that was a great idea. I think it was fun. Ditch the cloth masks. And
Yeah.
how do we spot the fake? So this is really more about spotting the fake N95 mask. Help us out, Dr. Mel.
Right. Well, ditching the cloth is just a reminder to ditch the cloth, because the
Right.
cloth masks are not as effective. If you're stuck on your cloth mask, make sure you're wearing it with a surgical mask underneath. Now, when you go to buy your N95s and your KN95s, how do you know you're not getting a cheap knockoff, right? So the United States certifies N95 masks through an organization called NIOSH, NIOSH. And on the NIOSH website and also on the CDC website, there's a list of approved N95 masks. So you can just go there and reference, hey, is this one that I see on Amazon official? And all N95s should have a cup or a flat fold or look like a duckbill shape. 2 straps that go around your head for the top and the bottom, and a wire bridge over the nose. That's what a real N95 should have. It should also have the word NIOSH on it somewhere, NIOSH approved. And if it says that it's FDA approved, it's a fake, because the FDA doesn't approve N95 masks. So that's like a dead giveaway. All right, so now that's N95. Let's talk about KN95. So the KN95s are certified in China, but there's no sort of official government body that does it. So there tend to be many more sort of knockoff KN95 masks. So the CDC does have a list of signs that a KN95 mask is counterfeit. So one of them is that it has manufacturer claims that the KN95 was approved by the FDA, the CDC, or NIOSH. Because why? China is the one that approves them, not the FDA, the CDC, or NIOSH. So off the bat, you know that's going to be a fake. And then on the mask, it should say something about GB 2626, those numbers, and then either the year 2006 or the year 2019. So that should be on the mask. And then finally, you can get either of these at Home Depot, Target, Lowe's, or you can get them on Amazon. If you go to Amazon, it's good to get it from the manufacturer's approved store. So for example, 3M carries masks, it makes N95 masks. You might want to go to the Amazon 3M store. And that way you know that you're getting something that's real.
So don't get the ones that say no-ish.
Not
Naya.
Please don't use NIOSH, NIOSH.
You about to get a fake.
You're right.
It happens. I mean, I know someone who ordered bunches of masks. This was months and months ago, and he was wearing one out in public, and there was so much stuff in it he could hardly breathe with the mask on. Whatever chemicals or whatever they used in even the packaging. So be very careful. If you're wearing a mask and you feel weird because you're breathing something in, take a look at that too.
Right. Oh, and the other thing is the N95s that have that sort of square piece of plastic in the front that you can breathe out of, that's not good, because you're breathing out of it.
Right.
Those are made for certain industrial kinds of situations. They're not good for protection for other people. So
wow. So that we've ditched the cloth masks, and now we know how to spot the fakes. But it was a breakthrough this week. We have a couple friends, right, that have MS. So they said that is Epstein-Barr virus the cause of MS. So
yeah, that's huge, because for so long we haven't known what causes multiple sclerosis, which, by the way, African Americans are at a 47% higher rate risk of getting multiple sclerosis or MS as compared to whites. So there was a study that was done at Harvard. They looked at 10 million military recruits, and they found that Epstein-Barr virus, which is a super common virus, about 9/10 of the world's population at some point during their life will be exposed to Epstein-Barr virus. That an infection with that is associated with a 32-fold increase in a case of multiple sclerosis. And so it does appear that having this exposure, this infection with Epstein-Barr virus, puts you at greater risk for getting MS. And it's only a small subset of people who do go on to develop MS, but the association is there. And for people that don't know, MS is a disease of the nervous system where your body makes antibodies that then attack the lining of your nerves. And so it can lead to anything from fatigue to depression to visual loss to movement problems to continence issues. And it's unclear why only a small percent of people progress to get MS after the Epstein-Barr infection, but it could be genetics that are at play. But at least if we now know, this causative factor, this infection, then there can start to be therapeutics or ways to address preventing the infection with the Epstein-Barr virus.
Would we know Epstein-Barr by another name?
It does cause EBV. It does cause chronic fatigue syndrome. So that might be also where you may know of it.
Is
and
it a
it
herpes
does
virus?
also, and it can, yeah, it is a herpes virus. Yes, exactly.
Be careful out there. So Dr. Clarke,
It's not the same as the sexually transmitted herpes of your genitals.
Okay,
yeah.
see,
That's why I didn't want to say it, because I didn't want people to get confused.
Okay,
but go ahead.
See, there we go. So Omicron. Let's get back to Omicron. And people are at these at-home tests are trying to time when to take a test. So they need to know when they're shedding. What's going on with Omicron?
Okay, so this is a thing. So the CDC came out with these guidelines that after 5 days, if your symptoms are resolving, you can go back out in public just with a tight-fitting mask on. And then recently, I think in the last couple of days, they were like, well, when you go back out in public, don't be around obese people, pregnant people, people with diabetes, people with a history, like this long laundry list of people you can't be around. And it's probably because of research that has now come out of Japan that shows that unlike Delta, Omicron sheds and is infectious for a longer period of time after symptoms start. Looks like about 3 to 6 days after symptoms start, which was a little different for Delta. Delta, you were infectious 2 days before the symptoms and then 3 days after, which is why they came up with the 5 days. So based upon this, and again, it's just one study out of Japan, but I think it casts enough doubt on, is 5 days really the best period of time? If you want to be super safe, you want to protect the people around you, you might want to continue to stick with that 10 days, especially if you're still having symptoms. And and if you go out in public, make sure you're wearing a tight-fitting mask like an N95 mask, because you want to make sure you protect those people around you.
Fantastic. So listen, Miss Yvonne, we're getting to it. She's asking, she says, tell us about getting these free at-home tests. So
all right,
number 5 is testing 1, 2, 3, 4. Mic check.
Okay, so
there gonna be some free tests available.
Yeah, actually, so starting January 19th, so Wednesday, every home in the United States can order 4 free tests with no shipping costs. And to do that, you just go to covidtests.gov. So test with an S on it, covidtests.gov. And then already in effect, as of this past Saturday, every American with health insurance can get up to 8 at-home COVID tests, over the counter ones, at a cost up to $12 a test. So you could either purchase the testing kits at no cost, or submit, depending on your insurance carrier, or submit the receipts for reimbursement to your insurance company. So a family of 5 could be reimbursed for up to 40 tests per month under this plan. So I think that's huge in terms of getting testing out to people. So you got your free tests from covid.gov, covidtest.gov, and you got reimbursement if you have health insurance for up to 8 per person.
Awesome.
All right. So what
do.
time is it, Wayne? Is it that time now?
You do know what time it is. It is
Indeed.
time for
a weekly debunk. Stopping misinformation in its tracks.
So we have Tony, the cousin of Tyrone Twitterfingers. And Tony Twitterfinger says, Omicron ain't nothing but a super cold. I'm going to go ahead and get it so I could just be through with this Rona.
Tony, I don't know about that. Excuse me, Dr. Mill, is that true?
Well, I have heard people say they're going to do this strategy because it does appear that Omicron is milder for both vaccinated and unvaccinated individuals. However, I don't think it's a good strategy. And here are the top 4 reasons why I don't think it's a good idea. Number 4, if you get it, you still are going to spread it to other person. Each person spreads Omicron on average to 4 to 5 other people. So when you get it, you're probably not going to be getting it by yourself. You're going to be passing it on to others. Number 3, immunity from infection, also called natural immunity, which is what Tony is talking about, does not translate to lasting protection against future infection from other potential corona variants coming down the line, nor from Delta, which is still circulating out there. We know that if you had Delta, you're still susceptible to getting Omicron. So it's not necessarily going to allow you to be free from the Rona, by the way. Number 2, if you're not vaccinated, it can still, even though Omicron is milder, we're still seeing 2,000 deaths a day. So individuals are still dying and getting hospitalized from Omicron, especially if you're in a vulnerable group, meaning you have some kind of underlying health condition from overweight to obesity, lung, heart, kidney disease, depression, etc., or if you're pregnant. And then the number 1 reason, we still do not know the rate at which Omicron causes long COVID. So with previous variants, even mild infections where there were no symptoms, your body can generate autoantibodies, so antibodies to itself, up to 6 months after full recovery from COVID. And these antibodies can attack your body and lead to the symptoms that we know of long COVID: shortness of breath, fatigue, problems concentrating, insomnia, brain fog, body aches, depression, etc. All these things known as long COVID. 32% of people with long-term COVID complications had no symptoms at the time they had their COVID infection. We know that vaccination diminishes the rate of long COVID. We don't know what the statistics will be with Omicron and long COVID. So for that reason, if you can avoid it, don't purposely go out and get Omicron.
All right.
And there you have it.
All right. Well, thank you all for joining me for our debunk and the recap. I hope folks are putting their questions in the chat because, we're going to be getting to them soon. But we are going to move on in to our show for tonight to honor the drum major for peace, righteousness, and justice, Dr. Martin Luther King. One of the reasons I do what I do, which is seek to empower us as healthcare consumers, is because I saw so much as an emergency medicine physician of people falling through the cracks in the healthcare system. And they're not falling through the cracks because of something they did. It's because of the healthcare system and the way it's structured and biased against certain members of our communities. There are fewer doctors and clinics, so fewer access points. for healthcare in less resourced communities. And in those same communities, we see fewer grocery stores and more liquor stores. So less of an opportunity to stay healthy in terms of nutrition. We have a harder time getting around in certain parts of town and getting to doctor's appointments, et cetera, because of poor transportation. And when many people, African Americans and other people of color, get to the doctor's appointment or get to the emergency department or get to the hospital, they often get disrespected or talked down to when they try to access the system. And that can be exacerbated because they have Medicaid or no insurance at all, and Medicaid, we know, pays less than commercial insurance and Medicare, which serves as a disincentive for healthcare professionals taking that form of insurance. So all of these and so many more things contribute to the disparities that we see in health and healthcare. And Dr. Martin Luther King said, of all forms of discrimination and inequalities, injustice in health is the most shocking and inhuman. So we're going to dig into health justice tonight and how it plays out in our own lives, the lives of our families, and the lives of our communities. In honor of Dr. King, we're going to be talking about this and how we can each be drum majors for health justice in our own way. We have two incredible guests who are going to walk us through this tonight and who are drum majors in their own right. Our first guest is Nicole Steele. She's the Director of Health Equity Programming and Social Justice at the Social Justice Learning Institute. Her dedication to this work began as a resident in the Inglewood neighborhood of Los Angeles in the healthy food space, and it's blossomed into healthy gardens, nutrition education, and food advocacy. Welcome, Nicole. Thank you so much for joining us.
Hi, thank you for having me. Happy Dr. King Day.
Happy King Day. And our next guest is Mr. Mustafa Abdul-Salaam. He's the founder and facilitator of the Ward 8 Community Economic Development Strategic Plan, which is a community-driven strategic plan to influence development in this Ward 8 section of Washington, D.C. He has degrees in social anthropology and urban management and economic development, and over 40 years of economic development and managerial experience. Thank you so much for joining us, Mr. Mustafa.
Well, my pleasure. I'm glad to be here.
Well, let's start off with Nicole first. So I use the terms health equity and health justice. Can you define those for us and maybe talk about it in terms of your passion in terms of nutrition?
Sure. I define health equity as the ability for all peoples to be able to access what will help them live their fullest life. Our health is what allows us as human beings to actualize, right? If we're healthy, if we're not sick, if mentally we are feeling well, we can do things in the world that contribute to the world and contribute to the well-being of each other, like making sure that we're tackling the problems of climate change, making sure that we're, creating thriving communities for our future generations. But when I look around me, I see a lot of people, and I think a majority of us know someone who's affected by a diet-related disease or a chronic disease like high blood pressure, diabetes. And those things happen because in some of our communities, we don't have access to the things that are going to help us thrive. I don't think that that's a circumstance of happenstance. I think that that is something that has been built into our environments. So the work that I do centers around creating a space where our communities can access those things that will keep them healthy, that will make them healthier and create legacies of health in our community.
Wonderful. And you bring up nutrition. What was there an aha moment for you, or was there something that said to you, nutrition is really what you should focus on in terms of health justice?
Yes, there were a few things that came together kind of synergistically. In school, I studied psychology. So I was working in my field at a group home with, young youth that had been taken from their home. And we started gardening and we started cooking together. And they started asking questions about the types of food that they were being served and learning, that blueberries actually start from a bush, not in a factory. And that helped them to start thinking critically about the world around them in a way that I didn't expect. At the same time, the man that I love, who is my husband now, we are just out of college and had good jobs and had health insurance for the first time as adults. And he found out he was hypertensive at a really young age. And it was, the doctor said it's directly related to the way that you've been eating this whole time. So just kind of that connection clicked. He's eating foods and we're eating foods that are convenient to us, that are inexpensive and that are in abundance in our community. But those same foods are causing, what's now going to be a lifelong problem. And some of my students that I was working with, these are 12-year-olds with high cholesterol and, things that just were making me really question what's available to us. So I said, well, if I can help people in the same way that I'm helping these students learn about food and it's making them think critically about their environment, if we can all do that as a community and it's something that we bring forward for ourselves, imagine how we might be able to change the world.
Right, right. You mentioned children. We know that rates of childhood obesity are actually the highest in the Black and Latino communities. What are some of the things that you've seen in the community that contribute to that?
Yes, so our school lunch program, while I appreciate what it does for our students, it provides meals for our kids and they need that. It could use some help. It could use some honesty and some constructive criticism about the types of foods that it serves. There is an abundance of highly caloric but low nutritious foods in our community. I live in Inglewood, California. Our city's maybe about 9 miles wide. There's over 250 fast food restaurants in our community. There's over
Wow.
150 liquor stores and convenience stores. And while we appreciate, what those business owners do for our community, they don't provide a lot of options that allow people to eat healthy food in a way that's easy for them. So I really am working on not only helping our community eat better through things like gardening and nutrition classes and free produce, but also holding our decision makers accountable for what they're allowing in our community and thinking about the health of our community in the way that they build our community, both economically and strategically.
Wow. So you bring up advocacy. I want to switch over to Mustafa. Um, so Mustafa, can you tell us what about your work in economic development in Ward 8 and maybe paint a picture for those people who are not from the Washington, D.C. area of the significance of Ward 8 in D.C.?
Well, I would like to. Ward 8 has a historical presence in D.C. It's known as East of the River, which is separated from the capital and downtown D.C. with a river. So in order to get on the other side, you have to cross a bridge. So symbolically, it has always had a separation. And for the last 60 years, particularly during the 60s, when you had the migration of white families out of the city, it has become really a dumping ground for people who had low income poverty. And as the city moved away from being the chocolate city that we know, the concentration of Black people have been more on the east side of DC, east of the river. So the last 10 years, there's been a real movement towards gentrification. The Homeland Security, which is the largest federal development since the Pentagon, is located in this community. And with that comes a lot of speculation of other businesses coming in. And, the residents understand, what gentrification looks like and the potential of them being displaced because of the economics around it. So we decided to come up with a plan that will allow the community to begin to look at what it needs to do to reposition itself. And a lot of it is about building wealth or focusing on wealth, because after 60 years of poverty, we are in a bad shape. And one of the statistics around health equity that's really glaring in DC is that there was a ward called Ward 3, which is the predominant of the high income population, which is only 5 miles from Ward 8. The discrepancy between life and death is in Ward 3, people live to be 83 years old, and Ward 8, 70. So you're talking about a 13-year difference in life experiences, and you're only 5 miles apart. I mean, it's almost like we're in a third world country, you would think, you know, and it basically has everything to do with poverty and the absence of wealth. And this is something that's been our legacy for the last 400 years. So there's been always structural challenges for Black people to build wealth. And because of that, we have less access to the resources that we need to live a quality life. So, and there's been a commercialization of poverty. You know, there's poverty has become a business. There's people that make livelihood off of poverty. You know, people get salaries off of poverty. So right now, there's not an incentive to lessen poverty because you have a lot of structures that benefit from it. So the community has to begin to recognize that we cannot longer operate with a deficit model. You know, there's places where only time you get resources from the federal government, local government foundations, is you talk about how poor you are. So it keeps us in this poverty mindset. We're moving towards asset-based economy where you have to have value. So what we're trying to do with this community economic development plan is put the emphasis on assets, on understanding what our assets are, and our human capital is our best asset, particularly our youth. So we need to invest in that. And so the relationship between health and economic is a clear one. You know, people who have the economic means have other options and can do things to mitigate disease and everything else. So for us, it's really focusing on that and creating opportunities where as a community and individually, we can build wealth.
So thank you. That is an excellent summary of that connection between economics and health. You know, oftentimes people might hear the term social determinants of health. How does social determinants of health figure into economic development?
It's a critical one because, you know, depending on your lifestyle has a lot to do with, you know, what your health is going to look like. So, you know, just things like having fresh air and having space where you can go walking without worrying about, you know, getting hit by a car has a lot to do with your health and the quality of your health. So when you're in communities, particularly urban communities that are not really designed for human beings as much as they are for, you know, maintenance and warehousing, that becomes a factor. Our community economic development plan focuses around looking at a child-centered, family-focused, community-based approach, which says that we want to measure the health of the community by the health of our children, and making sure that their well-being is the key, because children are the isotope for the whole community. If they're not doing well, the community is not doing well. And if they're doing well, then you have a community that's functional, particularly if you're talking about a long-term strategy. You know, we talk about in our plan that if we're going to be successful, the child is born today, we need to begin to think about what we need to do in the next 20 years. So when they get 20 years old, they have the skills, the education, that they can go any place and do whatever they want. We can't wait till they get 5 years old. We can't wait till they get 10. So it's us as a community looking at a long-term strategy that allows us to build the resources to be able to take care of ourselves.
Well, I think to your point, you mentioned third world countries. In some of our Black neighborhoods, our infant mortality rate, as I mentioned at the beginning, is worse than in some third world countries, quote unquote, third world countries. And so starting just from, you know, being in our mother's womb, it appears that there is actually health disparities that start at that young age and just move forward. In Ward 8, I think there's only one grocery store, right? Back to
well, there's
Nicole's
a
point.
smaller one that just came in, but yes. And that really illustrates the lack of assets that we have in the community or don't have. Yes.
Right. As compared to 16 grocery stores in wards
Ward 3.
1, 2, 3, and 4, right?
Right.
In each of those wards. Right.
Big difference. Yeah.
It's so interesting because it looks that way across the country. In Inglewood, where I am, there are 6 grocery stores, and they fluctuate. We get some, and they close, and things like that. But when you go to more affluent communities, there are multiple Whole Foods. There's one community that has 8 farmers markets, and we had to fight for years to change the zoning just to have a farmers market in our city. So, it's so interesting to me and so telling to me that in communities of color and high resource or under-resourced communities across the country, it looks so similar.
Yes.
And that brings me to my next question, because if we didn't design it, what is our role in deconstructing these barriers to health? I'll start with you, Nicole.
For me, I think that a large part of it is holding people accountable to acknowledging what has happened, because oftentimes our communities get gaslit, right? You need to move on. It's time to, just push forward. We didn't do it. That was something that was done in the past. But it plays a big role in how we see ourselves and how we're able to move forward if we're constantly being told that the things that we feel and the things that we're experiencing aren't a big deal. So that's a big part of the work that we do. But along with that, we really want to encourage folks to get involved with creating those changes in their community. And it doesn't even have to be a big thing, right? We encourage people start a walking group, right? You got, mamas and aunties and tias and abuelas in your community that need to be able to get out and walk and participate in physical activity for their health, but they may be a little bit nervous about that, or they may be afraid or not, be comfortable with the neighborhood. But if you're comfortable with the neighborhood, you've been there a long time, and this is something that you can establish and do with people, build community around that and do it. And it kind of catches like wildfire. Start a garden, right? We started a program where we helped build over 100 gardens in our community at local schools, in people's homes, at churches, so that people could see each other doing this work together, find pride in it, and then share that with each other. And then through those touch points, we want people to find out what SJLI is doing, and SJLI stands for Social Justice Learning Institute, but find out what we're doing around advocacy. What kind of policies are we working on with our city government? Can you make it to the next city council meeting and learn about the talking points that we're bringing forth as things develop in our communities? So what we hope to do with our work is provide a touch point for folks, right? Maybe you need fresh produce. You can come to get that from us for free. Maybe you need to learn about how to create healthy meals for your family. You can come and learn about that with us for free. Maybe you're looking for physical activity. Come do Zumba with us for free. But then we're going to teach you about the advocacy as well. We're going to teach you about the history and the food landscape here and help usher you through to create the changes in community with us.
Excellent. Excellent. And then same question for Mustafa. How would you, tell people to go about deconstructing, and what is the role that each of us have in deconstructing these barriers from an economic standpoint?
Excuse me. Let me get myself in here. My approach has been the plan.
I think we might have. Are you there? It froze for a moment. Maybe start. Maybe start again.
Yeah, and there's a saying in the field of planning that either you plan or you're planned upon. And so a plan is important, because what happens, particularly with people of color, and around gentrification, we'll come to the table with the developers and the city government wanting them to speak to our needs, but they have a plan that speaks to their needs. So, and they're not really, that's not their priority. So unless the community has a plan where we can counter their plan, then we go away angry because we don't hear our plan in it. And the reason why we're framing this around community economic development, because unlike traditional economic development, community economic development talks about the things that are important to us: livable wage jobs, affordable housing, adequate health care, education system that works. These are the things that improve the quality of our life. But that's not necessarily what the city government has in their plan or developers have in their plan. So if we're relying on other people to create plans for us, then it's never going to happen to our benefit. And when you have top-down plans, this usually comes from places like city government and developers who in many cases don't even understand the community. So we, over the last couple of years, have actually created a bottom-up process. We have 11 subcommittees that reflect a lot of the things that go on in the community, like housing, like education, like workforce development, which has given the community an opportunity to participate in a very meaningful way. So when the plan is produced, they own it. It's not something that is going to sit on somebody's shelf and collecting dust. They own it, and therefore they're going to make sure that it gets implemented. So I put a lot of emphasis that as a community, we need to understand the role of planning and invest in planning, because in the long run, it's going to help us, because a lot of our issues are structural, and it's going to take more than a couple of years to change.
Right.
At minimum, we got to need, 20-year plans, like I said, for that child that's born today, to make sure when they become adult that they are developed in a way that they can be effective. And planning allows you to do that.
Excellent point. So, wow, I think we have to stop here and go to questions from our audience. I'm going to bring in our producers back, Lila and Wayne. See if you have any questions from the audience. We're having this really rich discussion right now.
It's so good. It's so good. I almost hate to stop. There are lots of questions. I just have to say, Nicole and Mustafa, thank you so much for joining and having this rich conversation. We could listen to you. I could for another hour. This is awesome stuff.
I could too. I mean, being a Ward 4 resident, I grew up in Ward 4 and then moved outside of Ward 8 to the Suitland, Maryland area, which was a suburb. So I know the plight of, the tale of two cities.
Yes, it is. Yes.
Go ahead, Lila.
I think we both do, right? Like Nicole is saying she's from Inglewood. I grew up in the jungle, Nicole. So here in LA. And so I'm gonna get to this question because I think this is super important. It comes from Yvonne. Hang on, it was about grocery stores. And Yvonne, I'm paraphrasing. I can't find it just yet, but Brother Wayne will find it possibly while I'm asking. How come even when we have grocery stores, even when we have grocery stores in our communities, the produce section is so scarce? Can someone speak to that and how to correct it?
So I can go first if you don't mind, Mustafa.
Yeah, please do. It's directed to you.
Yeah. So one of the things we learned through community participatory action research is that our grocery stores tend to have a smaller produce section. Our produce tends to be more expensive than it does in more affluent neighborhoods. And it's a poorer quality of produce.
Absolutely.
What we found out is that because people in high need or under-resourced areas rely so much on cheaper shelf-stable foods, our grocery stores react to that. So their inventory reacts to that. So what happens is an emphasis is put on all of those things that we find in the aisles, on the shelves, things that can stay on the shelf for a very long time, be purchased in bulk, be purchased very cheaply. And our produce, they don't put as much emphasis on it. Sometimes we're even getting produce that was in a grocery store in a more affluent area. It extended its shelf life over there, but it's not bad yet. So they bring it into our communities and put it in our grocery stores. What also ends up happening is because people in more affluent neighborhoods kind of have a different knowledge around nutrition and eating than we do. They buy more fresh fruits and vegetables. The prices in our grocery stores help to subsidize the prices of produce in their grocery stores. So you'll find that because we don't buy as much produce, our produce is more expensive to help meet the bottom line. Whereas in those neighborhoods, because they buy a little bit more, their produce tends to be less expensive and higher quality. How do we fix that? One of the ideas that I have is growing food, right, in small spaces. I think for the future of not only our environment and our, global kind of environmental situation, we need to be growing food in smaller spaces to feed people in smaller spaces. So community farming and gardening, I think, is going to be a big deal in the future. But also we need to establish our own grocery stores.
Absolutely.
I think we need to be establishing our own grocery stores.
Right.
That is the point. We need to move away from being consumers and be producers, because when you produce, you control. And again, it talks about understanding the importance of economics. Really.
And I have to just jump in here and say I always talk about the 5 self-health actions. And we've touched on 3 of them here: stress, nutrition, and exercise. The other 2 are hydration, keeping well hydrated, and getting enough sleep every night. And those things control inflammation in our body, the bad kind of inflammation. The more good things that we do in those 5 categories, the lower the inflammation, the lower our rates of chronic disease like obesity and kidney disease and high blood pressure and lung disease, etc. And so when we own things and we feel that we have more agency in our life, that lowers our stress level. Stress
Yes.
really comes from feeling overwhelmed and out of control. So if you take the reins in terms of your food production, in terms of planning in your community for your economic development, these things help to bring your stress levels down at the same time as being able to get you the nutrition that you need to help keep levels of inflammation in your body down.
Absolutely.
Good
Absolutely.
point. Good point.
Any
We
other
can't hear you, Brother
questions?
Wayne. Yeah, Wayne is talking to us, but we can't hear you, sir.
Okay, my bad. I guess tonight is Yvonne's show because
It is.
she has
is.
one of 23 questions
She does.
or statements she has made, and we love her. We love her. She said, Dr. Mel, those 5 things need a show on each one.
Yeah, well, we've done one on sleep. We've done
Right.
one on nutrition. So yeah, we need to do one on exercise,
Right.
hydration, and yeah, and no, we done
Okay.
yeah,
And
yeah.
she said, Yvonne says she's growing her own lettuce and tomatoes in her condo in an
Yeah.
aero garden, hydro gardening. Okay,
Yes.
but it is one. She has this question: what do these people do to change their purchasing patterns of healthy food?
That is so difficult. We make do with what we have. That's something that's very magical about our community, something that I take much pride in, is that our people have always been able to make do with what we have. And sometimes our habits, though they may be detrimental, are a result of that. What I encourage people to do when we teach our nutrition classes, because again, we got to meet people where they are, is to pick one thing that they can change and master, and master that. So it may be that you buy, a 99-cent bag of chips every week for lunch, for your lunch for work or your children's lunch or whatever that looks like. Let's change that to, instead of buying a 99-cent bag of chips, I'm going to buy, a 99-cent box of blueberries from the 99-cent store. We have this really cool store out here called the 99-cent store. I don't think it's on the East Coast, but they have a really awesome produce section, and you can get, good produce for 99 cents. So if you can master that, it might take you a month to master that, but master that thing, get on it, and then maybe the next month or 2 months later, you say, you know what? This month I'm tackling hydration. Dr. Mel said that that's one of the things I need to be paying attention to. Instead of drinking 6 sodas a day, I'm going to take it down to 4, right? And then you master that and then move on to something else. And you look back over a year and say, wow, I really made some changes. But it is something that takes a long time, just like legislation and advocacy. Those personal changes, they take a lot of intention. So have some grace with yourself and just be very consistent.
Wow.
Excellent
Good
points.
point.
And those
I love
sugar
that.
sweetened beverages are also a
Yeah.
culprit in lots of disease, obesity, overweight, high blood pressure, kidney disease. And there's a lot of advocacy work actually around just getting rid of sugar sweetened beverages in spaces where children are, like in schools, in hospitals, in certain businesses, and housing complexes, the vending machines, because they are such a source of hidden calories and sugar, which can lead to inflammation.
All right.
Yeah, I would like to add a piece too, and that's encouraging the individuals and communities to look at meditation as a way of dealing with stress management. Because as Black people, we're going to be under stress. You can't get around that, but it's how you manage it. And meditation's been around for thousands of years. It's an excellent technique. It's been scientifically proven that it can control, your hypertension and a lot of other social issues. And there's been studies that show that children that meditate tend to function better in schools. So it's a very low cost type of effort But if we had more people meditating in the community, I believe you will see a much calmer and peaceful environment. So I would encourage, that people look at that as one of the techniques to incorporate.
And I would suggest that everybody go back to our show of December 13th, where we actually featured the Ward 8 Transcendental Meditation Center.
Okay. Excellent.
That was
That's what I'm talking
founded
about.
exactly,
Yes.
that was founded exactly for that reason.
Yes.
And
Yes.
yet another beautiful, resilient part of Ward 8 that we featured.
Indeed. And
any
I know
last
we're running out.
question
We're
that we can
running out
get
of
in?
time.
Yeah, we're out of time. Go ahead,
Wow.
Lala.
Okay.
I was just gonna say it isn't meditation, but Nicole, I do believe you teach a trap Zumba class, right?
I do, and I think that something that our community can definitely benefit from is kind of decolonizing their thoughts around meditation, because sometimes it comes in different ways. Yeah, I teach a trap Zumba class that really helps to get people moving in a way that's a little bit non-traditional, but to be honest, it's actually really traditional to our African roots. So yeah, it's a really great way to let some steam off, but also get your body moving. So yeah, thanks for the plug.
And that is a great note to end on, because when we move, not exercise, just move, our muscles release a chemical called scalaxin, which helps to decrease inflammation in our body. So that's the connection between movement and health. So thank you so much for all that you do. We have learned so much tonight from you, Mustafa, and from you, Nicole. I hope it inspires our audience to go out and be their own drum majors for justice, even in small ways, for our community. I love Mustafa's point about measuring the health of our community by our children. I think that was just so profound, because what we can put in place today as adults will help to affect the health of our community for years to come if we focus on our children. So thank you each for joining us. I hope this Dr. Martin Luther King celebration has been one that has been impactful to everybody who's listened. I want to also just bring up a reminder that we here at Excuse Me Doctor are participating in a Howard University Research Center study. Their engagement team around the Research Center and Minority Institutions Community Engagement has reached out and asked us to invite our listeners to engage in a COVID resilience research study. Participation in the study is totally voluntary. If you choose to participate, it basically means that you'll fill out 2 surveys, and each survey asks about your experience with discrimination, health concerns such as medical symptoms, and social concerns such as employment or childcare, etc. You'll be paid up to $100 for participating based upon what you complete. And being in the study is of no cost to you. If you're interested, please reach out to Dana Harvey Research at Gmail. That's my our research assistant on this study, Dana Harvey. So Dana Harvey Research at gmail.com. And that's the phone number, 470-795-0329, to get more information. Or you could just also, in addition, you can indicate in the chat if you're interested in participating so that we can follow up with you. So either way, reach out to us or put in the chat that you want to be reached out to. And that's it for us tonight. I will be on the Russ Parr Morning Show next Monday. So I was on Tuesday. I'm going to be on Monday, every Monday morning at 7:45 Eastern Time. Again, we will be back here next Monday night, 9 p.m. Eastern, 6 p.m. Pacific on YouTube and Facebook. Remember to hit subscribe and like. Thank you so much for joining us. And remember, be wise, be well, and be health empowered. Thank you so much.
Thank you. Good night, everybody. Take care.
Every now and then I wonder what I want them to say. Tell them not to mention that I have a Nobel Peace Prize. That isn't important. Tell them not to mention that I have 300 or 400 other awards. That's not important. Tell them not to mention where I went to school. I'd like somebody to mention that day that Martin Luther King Jr. tried to give his life serving others. I'd like for somebody to say that day that Martin Luther King Jr. tried to love somebody. I want you to say that day that I tried to be right on the war question. I want you to be able to say that day that I did try to feed the hungry. I want you to be able to say that day that I did try in my life to clothe those who were naked. I want you to say on that day that I did try in my life to visit those who were in prison. I want you to say that I tried to love and serve humanity. Yes, if you want to say that I was a drum major, say that I was a drum major for justice.
My name is Dion Davis. I've tried to live my life with no regrets, but I guess my final regret is not getting vaccinated. Please, don't let not getting vaxxed be your final regret.